Hi. You've probably heard that Alberta Health Services now uses rapid point-of-care testing as part of its COVID-19 testing process. It's an important tool to help prevent the spread of the virus in communities by allowing AHS to quickly determine if someone is positive in certain circumstances. Those circumstances include anyone who comes into testing with COVID-19 associated symptoms or a person who has been a close contact to a confirmed positive case. Now, the booking process is exactly the same. Just go to ahs.ca/COVID. Once you're on the site, just click Book a Test and answer the questionnaire truthfully. And if the questionnaire determines that you do require testing, just continue along the process and book your test online.
So on the day of your appointment, just arrive during your time slot. It's going to be one of two types of testing facilities, either a drive-through where you actually stay in your car and you're tested there, or a walk-in place, just like this one. Now, regardless of what type of facility you're getting tested at, you're going to have to remember a few things. First of all, you got to wear a mask. That's for safety. Second of all, you need identification, both photo identification and your Alberta healthcare card.
I'm going to ask you to sanitize your hands, please.
Hi there.
Hey, how's it going?
I'm going to be doing your test here today. What's the reason that you made your booking?
Having some symptoms.
So with that, you qualify to have a rapid test done today.
Depending on which location you actually get your test done at will depend on what type of rapid test you receive. Generally speaking, in the urban settings like Big Calgary and Big Edmonton, you're going to require a nasal swab to work with the type of rapid test they use, whereas other sites, like more rural and suburban areas, you'll require a throat swab to work with the equipment that they use.
Okay, so stay nice and still for me and start taking a breath in through your nose.
If you choose to receive a rapid point-of-care test, you'll receive 2 swabs, as negative results from rapid testing are sent to the lab for confirmation to ensure we don't miss any cases of COVID-19. And positive results receive further testing to see if they are one of the new variants. Once your sample is taken, it's put into this machine that will provide a result in about 15 minutes.
When it comes to communication, you're going to get one of 2 texts. Either it's going to be positive within that 6-hour window, and that's to let you start your isolation process immediately. It also helps out our contact tracers. If it's not immediately positive, you're going to get something that says it's indeterminate and it requires further testing back at the lab.
AHS has also introduced rapid testing at outbreak sites using mobile testing facilities, as well as for general screening purposes in continuing care facilities, schools, and businesses across the province. When used for general screening purposes, individuals only need to have 1 swab collected. If the test is positive, you need to start isolating immediately and obtain a second test from an AHS assessment center to confirm the positive result. Now, if the test comes back negative, you should still continue following standard public health measures, as it's still possible to have COVID-19. If you have any questions about how to properly self-isolate, COVID-19 testing, or any questions in general about COVID-19, please again visit ahs.ca/COVID. Let's stay safe together.
Alberta Health Services. Healthy Albertans, healthy communities, together.